welcome. Let's look at the gluteus maximus. The gluteus maximus is seen to be overlying on the gluteus medius and the gluteus minimus. I have put up a lecture on the gluteus minimus and the gluteus medius. If you check up that lecture, please kindly go and do so. For this class, we would be focusing on the gluteus maximus. Let's try and use this image by the side here to illustrate where the gluteus maximus is located. This is where we have the gluteus maximus here, arrowed in yellow. We said that this muscle is seen to be lying over the gluteus medius and the gluteus minimus, which means that the gluteus minimus and the gluteus medius are seen to be lying deep to this muscle. In this lecture, we would be looking at how the fibers of the gluteus maximus originate and also where they are finally inserted upon. We'd also be highlighting some features that you should know as students of anatomy. The gluteus maximus is the most superficially placed muscle in the superficial gluteal region. We've tried to highlight this in our previous slide where we said that the gluteus maximus is seen to be overlying on the gluteus medius and also the gluteus minimus. It is also the largest and the strongest gluteal muscle. Remember in our lecture on the gluteal region, in that lecture, we tried to classify the muscles of the gluteal space into the superficial compartment and the deep compartment. The deep compartment, just as the name implies, is a collection of muscles that are located or embedded deep within the gluteal region, while the superficial compartment is a collection of muscles that are seen to be overlying on the deep compartment. Within the superficial compartment is where we have the gluteus maximus. I would say that this gluteus maximus is the most superficially placed muscle within the superficial compartment. If we try to use this image by the side, this is where we have the gluteus minimus. The gluteus minimus is the deepest muscle within the superficial compartment. And this is what is highlighted here in red. This gluteus minimus is then seen to be overlying by the gluteus medius. And this is what is highlighted here in green. This gluteus medius is then seen to be overlying by the gluteus maximus. And this is what is highlighted here in purple. So you see that these gluteal muscles within the superficial compartment of the gluteal region are in layers. Where you have the gluteus minimus as the deepest, which is overlined by the gluteus medius, and more superficially overlying the gluteus medius is where we have the gluteus maximus. So you see that they are placed in layers, while the most superficially placed muscle within the superficial compartment is the gluteus maximus. And this is what is represented here in this image. Also adding to the number of muscles that we have within the superficial compartment is the tensor fasciae lata. And this is what is seen to be highlighted here in yellow. This tensor fasciae lata is seen to be located on the lateral edge of the gluteal region. So you see it at this lateral position here. This gluteus maximus is responsible for the shape of the buttocks. Remember, we said that this muscle is the largest and the most superficially placed muscle. So this muscle is what is seen to contribute to the formation of the contours that are created around the gluteal region. And this is why it is seen to be responsible for the shape of this region. So if you try to take all the muscles that are located within the superficial compartment of the gluteal region, we can say that in the superficial compartment, we have the gluteus minimus that is embedded deep, overlined by the gluteus medius, which is then overlined by the gluteus maximus. While on the lateral edge here, we have the tensor fasciae lata. So we have 4 muscles located within the superficial compartment of the gluteal region. Within these 4 muscles, the gluteus maximus is the most superficially placed muscle. Also, we should not forget that the superficial compartment that we have listed is seen to be overlying on the deep compartment. If we go back to my lecture on the gluteal region, in this lecture, we listed all the muscles that are located within the deep compartment of the gluteal region. So these muscles are then seen to be overlying by this superficial compartment that is highlighted here in this image. So let's drive further to describe the origin of the gluteus maximus. The origin of the gluteus maximus is different from the other gluteal muscles in the sense that it has an extensive point of origin. We have about 7 points where the fibers of the gluteus maximus is seen to originate from. And we would be highlighting all the 7 points in this slide. And because of this extensive point of origination, it is seen to be able to have the capacity to cover on the muscles that it is lying over. It's able to have the spread over the gluteus minimus and also the gluteus medius. So now let's drive through all the points where the fibers of the gluteus maximus originate from. The first point that we'll be highlighting is gluteal aponeurosis. The gluteal aponeurosis is an extension from the fascia lata. The fascia lata is an investing fascia of the muscles of the thigh. So around the thigh region, we have a number of muscles there that are surrounded by the fascia lata. This fascia lata is then seen to provide an extension around this upper edge here. So this is where we have the iliac crest, and between the iliac crest here and the gluteus maximus, we have the extension of fascia lata that is highlighted here in blue. So we have fibers of the gluteus maximus also extending at this point that is arrowed here in blue. So this is where we have the gluteal aponeurosis, and we have the fibers of the gluteus maximus extending from this region. The second point that I would be highlighting is the iliac crest. Specifically, it is the posterior edge of the iliac crest. If you look at this region that is arrowed here in pink, this region here is the iliac crest, and we know that the iliac crest is the most superior edge of the ilium, and this is why it is so named the iliac crest. So we have fibers also of the gluteus maximus originating from the iliac crest around this region. So this is the second point where we have the fibers of the gluteus maximus originating from. And we say that this iliac crest, it is specifically the posterior edge of the iliac crest. The next region is the thoracolumbar fascia. The thoracolumbar fascia is what is highlighted here in black. This thoracolumbar fascia is made up of multiple or several layers of fascia, and it is located around the thoracolumbar region. Around this space, this thoracolumbar fascia is seen to provide attachment sites for different muscles that are located around the posterior abdominal wall. So you have a number of muscles around the posterior abdominal wall, finding the attachment site on this fascia. Also, the gluteus maximus is also seen to have its fibers also originating from this fascia, and this is what is arrowed here in black. So the third region where we have the fibers of the gluteus maximus also originating from is the thoracolumbar fascia. The next region is the ilium. Specifically, it is the posterior surface or the gluteal surface of the ilium. More specifically, it is behind the posterior gluteal line. Remember in our previous lecture on the gluteus minimus and the gluteus medius, where we tried to describe the origin of these muscles, we said that the origins of this muscle is related to the gluteal lines. Let's use this other side of the ilium to illustrate where we have the emergence of the gluteal lines. We say that these gluteal lines are prominences that are created on the posterior or the gluteal surface of the ilium. This is where we have the ilium at this upper edge. And we know that this ilium, of course, is one of the structural components of the hip bone. At this upper region, we have the ilium. At this lower region, we have the ischium. While at the anterior part, we have the pelvis. So at this posterior region where we have the ilium, at the posterior or the gluteal surface of this ilium is where we have the emergence of the gluteal lines. And these gluteal lines are important because they will be used to establish the point of origin of this muscle. So this is where we have the inferior gluteal line here, arrowed in blue. This inferior gluteal line is an eminence that is created around the inferior region. And this is why it is being tagged the inferior gluteal line. If you go more anteriorly at the front, still within the posterior surface of the ilium, we have the anterior gluteal line. And this is what is arrowed here in blue. It is anterior gluteal line because it is anteriorly directed, although it is still within the posterior surface of the ilium. So if you go more posteriorly at this region that is arrowed here in yellow, we have the posterior gluteal line. So you see that these gluteal lines are created around specific regions and are so named based on the regions of the posterior surface of the ilium that they are located. So we have all these gluteal lines here as shown here on this other side. So if you go to this other region, you still have fibers of the gluteus maximus originating behind the posterior gluteal line. Remember, we have the posterior gluteal line at this space. So behind the posterior gluteal line, we have also fibers of the gluteus maximus originating from this region. So we see that it is also originating from the ilium, but specifically, it is originating behind the posterior gluteal line, which is, of course, is on the posterior or the gluteal surface of the ilium. I hope it is understandable as we try to carve this out. So going to the next region where we have the emergence of this muscle is the posterior lateral surface of the sacrum. This is where we have the sacrum here at this posterior edge. The sacrum, as a matter of fact, is seen to be linking the two hip bones together at the posterior region. So if you go to the posterior surface of the sacrum, while directed more laterally at this region, we also have fibers of the gluteus maximus also originating from this region. So the specific region of the sacrum where we have fibers of the gluteus maximus originating from is the posterior lateral surface. It is the posterior surface, but directed more laterally. And this is what is carried at this point. The next region that we have is the posterior lateral surface of the coccyx. Remember, inferior to the sacrum, the structure that we have is the coccyx. This is where we have the coccyx. Also, the posterior lateral surface of the coccyx at this region that is carried in green. We also have emergence of the fibers of the gluteus maximus also originating from this point. The last region where we have the emergence of the fibers of the gluteus maximus is from the sacrotuberous ligament. Remember, our sacrotuberous ligament is what is highlighted here in brown. I said that all we need to do is to always break down the name. If you break down sacrotuberous ligament, it means the ligament that is seen to connect the sacrum with the tuberosity of the ischium. Remember, we said that the ischium is located at this lower edge, and this is where we have the sacrum at this upper edge. So you have a ligament connecting the sacrum to the tuberosity of the ischium, and this is what is referred to as the sacrotuberous ligament. We also have fibers of the gluteus maximus also originating from the outer surface of the sacrotuberous ligament, and this is what is carried at this lower edge. So you see that we have 7 points where we have the fibers of the gluteus maximus originating from. We've tried to highlight this using this slide. So after their origination from the different points, you see that they are directed downwards and also laterally. And this is where you see these fibers here on this lateral edge here, where they will finally be inserted around the upper region of the lower limb. We will be driving at unfolding the specific regions where they are inserted upon in our next slide. But to go back to the point where they originate from, you see that they have 7 points where the fibers of the gluteus maximus originate from. And this is very extensive. And this is why it is able to provide the capacity to spread over the underlying gluteal muscles, which are the gluteus minimus and also the gluteus medius. So let's look at the insertion point of this muscle. This is where we have the gluteus maximus here highlighted in purple. After the emergence of these fibers from an extensive point that we described in our previous slide, we say that the fibers of this muscle are directed downwards and also laterally. So you see them at this inferior lateral edge here, where they will be inserted on the upper region of the lower leg. But specifically, let's try and unfold where they will be inserted upon. So this muscle first is going to be divided into 2 sub-regions. We have the upper region here and we have the lower region. This lower region is further subdivided into the deep part and also the superficial part. So the upper region and also the superficial part of the lower region of the gluteus maximus are inserted on the iliotibial tract. So it is seen to take up like 3/4 of this muscle. And if you look at how it is configured here in this image, going through this alignment that is created by this line that is highlighted in dotted white, upper region, which is made up of the deep and also the superficial portion, and also the lower region that is specifically made up of just the superficial portion. So if you take all these regions that are arrowed here in yellow, you see that they are finally inserted down here on the iliotibial tract. This is where we have the iliotibial tract here highlighted in red. This iliotibial tract is a band that is located on the lateral edge of the thigh. And this is where you have the bulk of the fibers of the gluteus maximus inserted upon. And you will see that it is indeed the bulk of these fibers because it is taking up like 75% of the entire gluteal maximus. So if you go to the remaining region, which will now be fibers from the deep part of the lower region, and this is what is arrowed here in pink. So this region, the fibers that are collected in this specific part and are inserted on the gluteal tuberosity. This gluteal tuberosity is a ridge that is seen at the upper region of the femur. So you see that this is where these fibers will finally be inserted upon. And this is taking like 25% of the entire muscle, which of course represents like 1/4 of the entire gluteal maximus. So you see that different portions or regions of the gluteus maximus are inserted on different regions. But all in all, the insertion points are in two places. So they are first inserted on the iliotibial tract, and secondly, another insertion point is on the gluteal tuberosity, which is created or seen around the upper region of the femur. So you see that this muscle, in previous slide, we tried to highlight their extensive point of origin. So their point of insertion is also in 2 points. And this is why you see that they present a large outline where they will be seen to cover onto the deep gluteus minimus and also gluteus medius. Let's describe the relations of the gluteus maximus. What are the structures that are related to this muscle? The first structure that I'll be highlighting are the bones. Remember, the gluteus maximus is located at the posterior pelvic wall, which is the gluteal region. And we say that it is the most superficially placed muscle. Of course, it will be seen to be overlying on the gluteus medius and also the gluteus minimus. So it has relationship also with bones that are located around this region. So what are the bones that we see around the posterior region of the bony pelvis? If we try to use this image here, this is where we have the bony pelvis. Specifically, this is the posterior view of the bony pelvis. And around the posterior region, we have the ilium and also the ischium. So this is where we have the ilium here at this upper head, while inferiorly here we have the ischium. Remember, the pubic is also one of the structural components of the hip bone, but it is not seen around the posterior region. The pubic is seen in the anterior region. So it will not be related to the gluteus maximus. So we have these two bones. So it is the posterior surfaces of the ilium and also the ischium that will be seen to be related to the gluteus maximus. Then we have the sacrum. Remember, the sacrum is seen to unite the two hip bones on the right and also on the left together. So specifically, it is the posterior surface of the sacrum also that will be related to the gluteus maximus. More specifically, it is the posterior lateral surface of the sacrum. Remember, when we try to create the point of origin of the gluteus maximus, we say that it is the posterior lateral surface of the sacrum that provides the point of origin of this muscle. So it will also be related to the posterior lateral surface of the sacrum. Then we also have the coccyx that is located more inferiorly, and this coccyx is also the posterior lateral surface of the coccyx that will be related to the gluteus maximus. Then we have the upper region of the femur. Remember, one of the insertion points of the gluteus maximus is the gluteal tuberosity. And this gluteal tuberosity is seen at the upper region of the femur. So you see that the femur is also providing a relation with the gluteus maximus. So these are the bony structures that are related to the gluteus maximus. So apart from the bones, we also have muscles that are related to the gluteus maximus. We have the deep gluteal muscles. Remember, we try to subdivide the muscular component of the gluteal region into the deep compartment and also the superficial compartment. We say that the deep compartment is embedded deep within the gluteal region, while the superficial compartment is seen to be overlying on the deep compartment. We try to use this image by the side here. We have a number of muscles, exposed here in this image, and these are the deep gluteal muscles. These deep gluteal muscles are also related to the gluteus maximus because the gluteus maximus is seen to be overlying on this muscle. So if you look at this muscle that is harrowed here in pink, this is the obliterator internus. Superiorly to the obliterator internus, we have the superior gemellus muscle because it is located above the obliterator internus. While inferiorly to it, we have the inferior gemellus muscle because this muscle is also located inferior to the obliterator internus. So you can see that the obliterator internus is located between the two gemelli muscles. And this is what is presented here in this image. If you go more superiorly above these muscles, you see that we have the piriformis. Then if you go more inferiorly downwards here, you have the quadratus femoris. So all these 5 muscles will come together to form the deep layer of muscles that are located around the gluteal region. And these muscles are also seen to be related to the gluteus maximus. We also have other muscles that are located within the superficial compartment, and these muscles are also related to the gluteus maximus. So let's see how they relate with this muscle. If you also use this image by the side, this is where we have the gluteus minimus. The gluteus minimus, we say that it is the most deeply embedded muscle within the superficial compartment of the gluteal region. This gluteus minimus is then seen to be overlined by the gluteus medius, and this is what is highlighted here in green. This gluteus medius is then seen to be overlined by the gluteus maximus, and this is what is highlighted here in purple. So you say that the gluteus maximus is also related to the other muscles that are located within the superficial compartment of the gluteal region. If you go more laterally on this lateral edge that is highlighted here in yellow, we have tensor facial lata. So this is how these muscles also within the superficial gluteal region will come together to form the superficial layer of the gluteal region. Remember that this superficial layer will then be seen to be overlying on the deep layer that we have highlighted. So this is how we have the different muscles within the gluteal region related to the gluteus maximus. And we've tried to highlight or illustrate how each of these muscles are positioned in understanding the relationship that they have with the gluteus maximus. The other structure that we have that is related to the gluteus maximus is the hamstring muscle. The hamstring muscles are located in the posterior region of the thigh. We also use this image by the side at this lower region. This is where we have the femur, and at the posterior region of the femur is where we have the hamstring muscles. But specifically, it is the upper part of these hamstring muscles that will be related to the gluteus maximus, and this is understandable. Then the other structure that you have at the bursae, we have a number of fluid-filled sacs located around the gluteus maximus. These bursae are seen to help reduce friction so that there would be easy movement between the gluteus maximus and also the structures that are located around it. So we have the truncateric bursa here highlighted in yellow. This truncateric bursa is located between the gluteus maximus and also the greater truncator of the femur. Remember, this is where we have the femur, and at this upper region is where we have the greater truncator of the femur. So you have this truncateric bursa located between the gluteus maximus and also the greater truncator of the femur. Say that this bursa is to help reduce friction so that there would be easy movement between this bony region and also the gluteus maximus. We also have the ischial bursa, and this is what is also highlighted here in yellow. This ischial bursa is located between the gluteus maximus and also the ischial tuberosity. Remember, this lower region at this posterior aspect is where we have the ischium, and this ischium is seen with the ischial tuberosity. So we also have a bursa created around this region where it is seen to be positioned between the gluteus maximus and also the ischial tuberosity. We also have the gluteofemoral bursa, and this is what is highlighted also in yellow. So this gluteofemoral bursa is located between the gluteus maximus and also the vastus lateralis. The vastus lateralis is one of the muscles that are located in the thigh region. So you also have a bursa created between this muscle and also this specific structure. So you can see that we also have bursae found or located around the gluteus maximus, where they are helping to also control, support the movement of this muscle. The other structure that we have are vessels. If you use this upper image here, this is where we say we have the posterior view of the bony pelvis. And at this posterior region is where we have gluteus maximus located. If you drive deep, within this region, we have the greater sciatic foramen. This is the greater sciatic foramen here that is highlighted here in blue. And inferior to the greater sciatic foramen, we have the lesser sciatic foramen. In our previous lecture, we have highlighted or described how the sciatic notches are transformed into this foramina, and they are created to allow for the passage of structures. So you have a number of vessels and also nerves passing through this foramina. And because they are passing through this foramina, they would also be related to the gluteus maximus, because we know that the gluteus maximus will be overlying on this foramina. So you have a number of vessels that are seen to pass through it. And one of these vessels include the gluteal vessels. We have the superior and the inferior gluteal arteries. The superior and the inferior gluteal arteries are emergent from the internal iliac artery. We know that the internal iliac artery is located or positioned within the pelvic cavity. And because the superior and the inferior gluteal arteries are arteries of the gluteal region, they need to exit the pelvic cavity so as to be able to access the region that they are programmed to provide blood supply to. So you see the superior and the inferior gluteal artery as the vessels that will be related to the gluteus maximus, and it is because they are sent to pass through the sciatic foramen. We also have the internal pudendal artery. The internal pudendal artery is also a branch from the internal iliac artery, and as it branches from the internal iliac artery, it is seen to be providing supply for the perineum. It also needs to exit the pelvic cavity, and this exit is also through the sciatic foramen. So you have a number of vessels exiting pelvic cavity through this foramen, and because of this, they are also seen to be related to the gluteus maximus. We also have a number of nerves related to the gluteus maximus, because these nerves will also need to exit this foramina for them to access the region that they are programmed to provide innervations for. So we have the gluteal nerves, we have the superior and the inferior gluteal nerve, because they are nerves of the gluteal region, and their emergence from the sacral plexus. We know that the sacral plexus is located within the pelvic cavity. So as the superior and the inferior gluteal nerves will emerge from the sacral plexus, they will need to exit the pelvic cavity so as to be able to access the gluteal region. This kind of pattern is also formed by the superior and the inferior gluteal arteries. So in doing this, they also need to pass through the sciatic foramen. And through this course, they are seen to also be related to the gluteus maximus. We also have the sciatic nerve. The sciatic nerve is one of the branches from the sacral plexus. This is a nerve that provides innervation for the lower limb. And for it to also exit the pelvic cavity, for it to be directed to the lower limb, it also needs to pass through the sciatic foramen. In this course, it is also seen to be related to the gluteus maximus. We also have the pudendal nerve, the nerve to the obliterator internus, the nerve to the quadratus femoris, and also the posterior cutaneous nerve of the thigh. These nerves are also emergent from the sacral plexus, and they also need to run their course so as to be able to access the different structures that they will be providing innervations for. And through this course, they are also seen to be related to the gluteus maximus. So you can see that the gluteus maximus is related to a number of structures as we have highlighted using this slide. And I hope that this is understandable. So now let's go through the actions of the gluteus maximus. The gluteus maximus is known to exhibit extension and also external or lateral rotation of the thigh. Also, the different subregions of the gluteus maximus are seen to exhibit different functions. For the upper region of the gluteus maximus, it is seen to allow for the abduction of the thigh, while the lower region of the gluteus maximus is seen to allow for adduction of the thigh. It is also seen to enhance hip stability. If you look through the point of origin of the gluteus maximus, remember we said that the gluteus maximus has an extensive point of origin where the fibers of the gluteus maximus originate from, and its insertion point. You see that it is seen to cross through the hip joint. And because of this, it is seen to help reinforce or stabilize the hip joint. And this is where it's helping to hold on the end of the femur into the acetabulum. Then the blood supply of the gluteus maximus is by the superior and the inferior gluteal arteries. The superior gluteal artery is the emergence from the posterior trunk of the internal iliac artery, while the inferior gluteal artery is an emergence from the anterior trunk of the internal iliac artery. Both gluteal arteries, the superior and the inferior gluteal arteries, are both emergence from the internal iliac artery. And these two arteries are seen to provide supply for the gluteus maximus, while the innervation of the gluteus maximus is by the inferior gluteal nerve. And the inferior gluteal nerve is an emergence from the sacral plexus. Remember, if you go back to our lecture on the gluteus minimus and the gluteus medius, we say in that lecture that the innervations of these two muscles are provided by the superior gluteal nerve. It is only the gluteus maximus that is seen to be innervated by the inferior gluteal nerve. It is important that we highlight this in case we are asked during examination. The gluteus maximus is seen to be innervated by the inferior gluteal nerve, while the gluteus medius and the gluteus minimus are seen to be innervated by the superior gluteal nerve. And this inferior gluteal nerve from the sacral plexus is specifically seen to be formed from the posterior divisions of the ventral rami from L5, S1, and also S2 sacral spinal nerve. So this is how they specifically emerge from the sacral plexus. Thanks for watching this video. Let's continue to stay glued to this channel.